Biomedical waste management is a critical discipline within healthcare administration and public health. This presentation provides a deep dive into the protocols, legal frameworks, and environmental necessities of handling medical waste. We will explore how healthcare facilities must transition from simple disposal to a sophisticated management system that protects patients, staff, and the broader ecosystem. Effective management is not merely a logistical challenge, but a fundamental requirement for hospital accreditation and safety compliance. Throughout this session, we will examine the journey of waste from the point of generation to its final destruction or neutralization, ensuring every stakeholder understands their specific role in this life-saving process.
The table of contents outlines our comprehensive curriculum. Lesson 1 covers the global context and epidemiological imperatives, establishing why this matters. Lesson 2 examines WHO guidelines and the Blue Book, the gold standard for global safety. Lesson 3 details the Indian regulatory landscape and the BMWM rules of 2016. Lesson 4 focuses on categorization and segregation protocols, the heart of waste management. Lesson 5 explores the supply chain, barcoding, and GPS tracking for digital oversight. Lesson 6 reviews advanced treatment and destruction technologies. Lesson 7 addresses specialized healthcare waste like liquid and electronic items. Lesson 8 covers radioactive waste management. Lesson 9 details biological spill management protocols. Finally, Lesson 10 discusses IEC strategies, sensitization, and future sustainability. The first module is titled The Global Context and Epidemiological Imperatives. This section is designed to provide the foundational why behind the strict regulations we see today. By understanding the global scale of medical waste and the specific diseases associated with its mismanagement, healthcare professionals can better appreciate the gravity of their daily actions. We will look at how international treaties and epidemiological data drive the policies implemented at the local hospital level. This context is essential for building a culture of safety, where waste management is viewed as a clinical priority rather than a secondary janitorial task. It sets the stage for the technical lessons that follow. Definition of biomedical waste, or BMW, refers to any waste generated during clinical diagnosis, treatment, or immunization of human beings or animals. It specifically encompasses materials produced during research activities or in the production and testing of biologicals. This definition is crucial because it differentiates highly hazardous medical material from general municipal solid waste. While municipal waste is largely organic or recyclable packaging, biomedical waste contains pathogens or chemicals that require specialized handling. Recognizing this distinction is the first step in ensuring that dangerous materials do not enter the standard trash stream, where they could harm sanitation workers or the public. The Basel Convention of 1989 is an international treaty governing the transboundary movement of hazardous clinical effluents and other wastes. It was established to ensure that hazardous wastes are managed and disposed of in an environmentally sound manner. A primary goal of the convention is that it prevents the toxic trade and dumping of infectious waste into developing nations. Historically, wealthier nations would export their dangerous waste to countries with weaker environmental regulations. The Basel Convention created a legal framework to stop this practice. By requiring prior informed consent, it ensures that no country becomes a dumping ground for another's medical hazards, promoting global environmental justice. Global waste volume metrics indicate that the global healthcare sector produces approximately 400 million tons of hazardous waste annually. This staggering figure highlights the massive industrial scale of healthcare operations worldwide. Such a high volume demands rigorous, standardized processing infrastructure to prevent ecological collapse. Without centralized treatment facilities and strict adherence to disposal protocols, this amount of waste would lead to widespread soil and water contamination. The sheer magnitude of 400 million tons underscores that biomedical waste management is not just a local hospital issue, but a significant global environmental challenge that requires coordinated international efforts and advanced engineering solutions to manage safely. The 85-15 WHO rule is a fundamental principle in waste logistics. It states that roughly 85% of hospital waste is benign, meaning it is non-hazardous and comparable to domestic or municipal waste, like paper and packaging. In contrast, only 15% is hazardous, comprising infectious, toxic, or radioactive elements that pose a risk to health. This distinction is vital for cost-effective management. If we can successfully separate the 15% that is truly dangerous, we can focus our expensive high-tech treatment resources only on that portion. Understanding this ratio helps administrators allocate budgets effectively, ensuring that hazardous materials receive the intensive treatment they require, while benign waste is handled through standard recycling and disposal. The contamination multiplier is a warning about the consequences of poor segregation. If hazardous waste is improperly segregated at the source, the 15% hazardous fraction contaminates the entire 85% benign volume. This effectively turns the entire waste stream into hazardous material. This failure multiplies treatment costs significantly because the hospital must now pay for the specialized treatment of a much larger volume of waste. Furthermore, this unnecessary volume overwhelms hazardous waste infrastructure, such as incinerators and autoclaves, leading to equipment strain and potential system failure. This principle emphasizes that segregation at the point of generation is the most economically and operationally critical step in the entire waste management chain. Epidemiological risk profiling identifies the specific health threats posed by waste. Untreated biomedical waste serves as a primary reservoir for highly resilient blood-borne pathogens that can survive outside the body for extended periods. This presents a direct transmission risk for hepatitis B, also known as HBV, hepatitis C or HCV, and HIV. These viruses can be transmitted through needle stick injuries or contact with contaminated fluids. Because these pathogens are often more resilient than common bacteria, the waste must be treated with validated sterilization methods. Proper risk profiling ensures that staff wear appropriate personal protective equipment and that sharp containers are puncture-proof, directly reducing the incidence of healthcare-associated infections among workers. Environmental toxicity vectors focus on the chemical dangers of disposal. Unscientific incineration of chlorinated plastics, such as certain IV bags and tubes, emits highly toxic dioxins and furans into the atmosphere. These carcinogenic pollutants are among the most dangerous chemicals known to science. They are particularly hazardous because they bioaccumulate in the environment and local food chains, meaning their concentration increases as they move up the food chain to humans. To prevent this, modern standards require the use of non-PVC plastics or high-temperature incinerators equipped with sophisticated gas cleaning systems. This point highlights that improper waste destruction can create a secondary public health crisis through environmental pollution. The occupier principle establishes the legal liability framework for waste management. Modern environmental laws impose strict liability on the occupier, which is defined as the person who has control over the institution, typically hospital leadership or the medical superintendent. This means that administrators face civil and criminal penalties for downstream ecological damage or public health violations, even if the error was made by a junior staff member. The law ensures that the highest levels of management are personally invested in the safety of the waste system. It moves the responsibility from the waste generator to the occupier, ensuring that there is clear, high-level accountability for the entire life cycle of the waste. Thank you for completing this foundational module on biomedical waste management. We have covered the global definitions, the international legal frameworks like the Basel Convention, and the 85-15 rule that governs efficient waste segregation. We also examined the epidemiological risks and the environmental dangers of improper incineration, concluding with the legal responsibilities of the occupier. This knowledge serves as the bedrock for the practical, technical skills you will develop in the upcoming lessons. Remember, every item correctly segregated is a step toward a safer hospital and a cleaner environment. We look forward to seeing you in Lesson 2, where we will discuss the WHO Blue Book guidelines in detail.